If you have ever left the doctor's office or, God forbid, the emergency department and you feel like you're more confused than before, your questions didn't even get answered, you were rushed through the whole process and maybe even dismissed at the same time, then this video is probably for you. I am going to be discussing what the heck is going on in our healthcare system, why so many nurses are leaving bedside, and really where do we even go from here? So I've pretty much been working in healthcare my entire adult life. I've been a nurse for over 15 years now. And for the longest time, I thought something was wrong with me. Like, why can't I just find a position I like? Why can't I find my niche? Why can't I stick with one department? I have tried so many different things, from med surg to psych to home health to pediatrics. And yeah, it turns out it wasn't that I wasn't finding the right department. It was the entire system was broken and completely out of alignment with my true core values. Our current healthcare system is burning out nurses and healthcare workers left and right, and we are leaving the bedside in alarming numbers because the current system pulls us away from why we originally got involved, which is to care, which is to educate, which is to be an advocate and to provide resources and to be of true help and aid when people are at their lowest. And when the nursing staff and the healthcare workers are suffering, ultimately, all of the patients suffer too. I hear it from friends and family all the time. Anytime they have to go to the doctor, God forbid the emergency department, they're leaving with a handful of prescriptions and more questions than answers. They're feeling dismissed, they're feeling gaslit, and they're feeling confused and a lot of times powerless. And this is exactly where nurse coaching comes in. I like to explain it to people like this. Imagine you go to the doctor's office or the emergency department. You get, 5 minutes with the doctor? They give you your diagnosis, they hand you some prescriptions, and then comes in the nurse. The nurse is going to explain things to you in plain English. The nurse is going to offer some resources. The nurse might even be able to have the time to establish an emotional rapport with you to make the whole experience feel a little bit more human, if you're lucky. Now with nurse coaching, just imagine that whole process, but instead of that 15 minutes with the nurse, you get a whole hour of undivided attention to discuss your goals, to discuss your life, wherever you might be, how you can get more empowered to take your health back into your own hands. That's exactly what nurse coaching is. We aren't here to prescribe. We aren't here to diagnose. We are here to fully, holistically support you. Supporting you in whatever area of life that you might need, whether that's nervous system regulation, whether that's establishing better boundaries, lowering your A1C, whatever health, wellness goal that you have, a nurse coach will be there to help you bridge that gap between where you are now and where you want to be. Nurse coaching is essentially for anybody who wants to break free from the limitations of this corporate healthcare system that we're currently having to endure, so you can feel more empowered to reach the goals that you have at whatever level you're at. It's the personalized care that you wish you could get with this current healthcare model, but unfortunately, the way the system is built, we don't have time to offer it. That is why nurse coaching exists. That is why I have transitioned my entire career to follow this pursuit. And that's why I truly believe that nurse coaches are going to change the world. I truly believe that we are in the midst of a renaissance. Healthcare and the entire system, these are revolutionary times. So nurse coaches, healers, for patients, providers, anybody that wants to step into their power, step back into their sovereignty, this is the right community for you. Feel free to follow along. You can find my socials in the links in my bio, and welcome.